Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Sir, I want to say a few things before we begin today to the audience. You know, we have done more than 105 videos together. So I encourage you to please look it up and watch it and learn from it. Today, sir, what are we doing? We're doing venereal disease. Which
Sure.
one do you want?
The syphilis will take
Syphilis,
it up first.
yes, we'll take up
Prime
syphilis.
thing.
Yes, fine. It was a very serious disease many, many years ago, and people died from it.
Not it was, it has been.
Has been. Huh?
Yes,
Ah,
yes, for ages. See, this is a venereal disease in the sense for spreading or transmission, it requires intimate contact. So that way it is venereal disease where
intimate sexual contact.
it need not be
could
sexual.
be by the mouth also.
Yes, it need not be sexual. Like for example, like blood transfusion. Then the same needles being used for pricking. So this can be the cause of transmission. But intimate contact, where mucosa to mucosa is a contact. If skin is fine and there is no sore or anything, then the transmission doesn't occur even with the contact. Like you touch each other or you shake hands with each other, there won't be transmission with that. But if there is an sore or an ulcer, and ulcer to ulcer or ulcer to abrased skin, if there is contact, then there would be transmission. That's why sexual contact is, for this reason, the scope for transmission, because there is always an intimate abrasion of ulcerated mucous membrane with each other. This is very popular disease from ages. Mainly it is so-called causative organism is detected by our pathologists, is a spirochetal organism, gram-negative bacterium, Treponema pallidum. This is the organism. It's a spiral, like a spring, and therefore they call it spirochete. But it's the funniest part of this is once it gets entry in the organism through some opening, then it goes on advancing, and primarily it doesn't cause any symptom. In primary stage, it just gives sometimes sore or sometimes even that also, that we call it chancre, primary chancre. Sometimes it appears, and that too it appears after 3 weeks of exposure, not immediately. So the person may not develop any reaction or any symptom after exposure to this infection. So primary chancre, it's a very peaceful, it's not painful, it doesn't give any discharge. A primary chancre appears, either a single chancre or multiple chancres, ulcers, and they also disappear after 2-3 weeks. So after 3 weeks the primary lesion occurs, and after 2-3 months again it goes latent, it goes dormant, it subsides, and then it goes on spreading in the body, multiplying in the body to form a secondary stage of syphilis. And in that stage it may develop some ulcerations, rashes all over the body, or it may develop a condylomatous growth or warty growth, especially at the mucocutaneous junction. So these condylomatous growths, again, it's a sign of secondary syphilis. And even after that, it may just again become latent and disappear without any treatment. And then it may directly go to tertiary stage. And tertiary means where it affects the deepermost organs, including nerves. The tabes dorsalis is one known complication where the nerves get degenerated. And our medicine teacher used to tell us that there is no tissue or cell which doesn't get affected by syphilis. It can affect every nook and corner of the body. But the funniest thing in this is, in some individuals, the multiplication or spread of these organisms is arrested by innate reaction and creation of antibodies. So sometimes this disease is located in a safer location. In computer language we can call it quarantined, and in the form of, say, condylomatous growth at the mucocutaneous junction, and then it is not allowed to spread. So funnily, in some individuals it is confined to one corner in a very dormant stage for whole life. But one thing is certain, that by the body itself it cannot be eradicated, it doesn't get eradicated. It may remain dormant in the system so that it doesn't affect any system. It may just have one punched out ulcer and nothing else, one perforated nasal septum and nothing else, or it may have a condylomatous warty growth at the mucocutaneous junction and nothing else. So it may remain silent and potent for the whole life, but the part is, it can even get transmitted through the pregnant woman. If suppose mother is having syphilis in some stage, then it may be permeated through the placenta to even the offspring. So you get even inherited or congenital syphilis got from mother. And that can be in any stage, like it can be in secondary syphilis, it can be tertiary syphilis, and again that may remain silent for the whole life, but there would be infection in the person which spontaneously will not be recovered by the body, though body produces antibodies against it. Rather, the presence of disease is detected from the antibodies, that test what we call VDRL. VDRL is indicator of presence of antibodies. But presence of antibodies doesn't indicate that your disease has been eradicated. In no course it gets eradicated, and it can simulate with any disorder, and not only that, it affects your immunity to such an extent that you are prone for getting cancer, you are prone for getting so many other disorders because of the syphilitic background.
Miscarriages.
Miscarriage. See, even miscarriages. The commonest complication in syphilis is the recurrent abortions. And the funniest part of this abortion is, like, clinically how we make out that it is because of syphilis is, initially the first abortion is in an early period. If consequent conception takes place, then it can be little later. So the female goes on conceiving, and the consequent conceptions, they are carried forward, and many times there are miscarriages at the time of delivery. There are stillbirths. Not only that, after that also there are like congenital anomalies like cleft palate and so many things. So in syphilitic
in the offspring.
In the offsprings. So in the female, if the female has conceived say 6 times, so first 1 or 2 times luckily there would be immediate abortion, but then the female may carry forward the conception for a longer duration, then maybe in the 3rd trimester there would be miscarriage. But after that again the female may complete the term, but the child will be with anomaly, birth anomalies. So it's the most dangerous thing. That's why routinely now these gynecologists, they are screening the females. As soon as you feel the female is conceived, then they used to take VDRL test. Even if there is some blood transfusion to
VDRL
take.
is
VDRL is Venereal Disease Research Laboratory, is a name of the test, which is antibody test, which tests the antibodies. There is antigen, and the antigen antibody test, it actually gives you the amount of antibodies present, and presence of antibodies means certainly the person has had syphilitic contact. In homeopathy also, Hahnemann has described this contagion. We call it contagion because we don't say that this organism is the cause of it. It can be a sort of a vector. It need not be, because what happens, every person doesn't react to syphilis in the same way. And funniest part is, we have seen that in what stage mother has been of syphilis, same stage is transmitted to the offspring. So there is much similarity of mother suffering from it and then the child coming out with it. But there won't be any primary chancre or something. It directly comes in tertiary phase. And we have seen children with perforated nasal septum. And the typical characteristic of this syphilitic ulcer is it is punched out ulcer, we call it. Punched out. As if, the skin has been punched. That type of typical punched out ulcers we get in syphilitic phenomena. But the worst thing is, sometimes spontaneously the disease goes into latency. The body, if it has good vigor, it may be thrown out on surface in the form of primary chancre or secondary syphilitic ulceration.
Would you define chancre for our audience?
Chancre is the type of ulceration or eruption it develops, the syphilis. And here, this ulceration or a skin lesion comes on skin as well as mainly on mucosa, where it is painless. It does not emit any discharge. It is just a sort of a skin lesion at skin level. It may not be elevated to the skin. It can mainly, especially where the mucosa is exposed. In males, we get in glans, penis, or in females also we get in vaginal mucosa, and which is hardly visible, as it doesn't have any symptoms or pain or discharge. Body people hardly realize. And clinically, what happens, if it is associated with gonococcal infection, gonorrhea infection. See, if the sexual contact, illicit sexual contact, the person is exposed to both the infections together, this gonococcal infection becomes evident, starts showing symptoms. That incubation period is very short for that. In 5-6 days, or even up to 3 days, the person will develop symptoms, inflammation because of gonococcal infection. As against this, the syphilitic chancre or the ulceration, syphilitic ulcer, primary syphilitic ulcer, appears after 3 weeks. And so this gets completely masked. So we have seen that gonococcal infections are diagnosed because they are painful and they are acute in nature, and people might get treated for that, and the syphilitic infection goes unnoticed. So this was like and especially with the inception of HIV. It's a immunocompromised virus. The incidences of syphilis and gonorrhea became very common, and even the transmissibility also used to be very high in HIV people, and therefore they developed full-blown AIDS and whatnot with this. But see, this in this syphilitic background, in homeopathy also, Samuel Hahnemann has described these miasms as a disease-producing tendencies. And this syphilitic miasm is like a slow degeneration. It's a continuous slow degeneration, and there is no spontaneous reversal unless there is intervention by the physicians with rational therapy. If it is not intervened, our own immune system will not be able to reverse this disease on its own. It may be able to make it dormant for a while. Dormant for a while means it may remain dormant for whole life of the person, but it will not be eradicated unless it is treated with physician's intervention.
I've got a lot of questions for you. We had seen a very good film called Out of Africa with Meryl Streep, and she got syphilis. and she had to go back to Denmark, and it was a terrible treatment. She almost died. And when she came back, she said to this gentleman that she had been married to, she said, I will never be able to bear a child again.
I understand that. I understand that because you just, as I described earlier, the conceiving for offspring for the female will be really a nightmare, because it will cause abortion, repeated abortions, recurrent abortions, and as the period for conception can be like prolonged.
So these are natural abortions.
Natural abortions
Yes,
by the
yes,
disease.
understand.
Yes, yes, spontaneous. Then the children are born with deformities, organic defects, the congenital anomalies like Fellas tetralogy or valvular disorders or cleft palate and whatnot, and innumerable congenital anomalies are seen in syphilitic mother, so children born with them. So it will be nightmare to bear with such children for them. And not only that, there are many, like there is, that's what I described, there's no tissue which doesn't get affected by syphilis. We have seen aortic aneurysm where the aorta suddenly bursts open, and it's a known complication of syphilitic phenomena in the aorta. The aortic aneurysm or aneurysm anywhere, it's a commonest complication of syphilis. We even tabes dorsalis, where people, they lose their control, they become, even cause of Alzheimer can be because of syphilis. So there are so many disorders, neurological disorders, musculoskeletal disorders. There are gametous ulcerations, the gametous growths, even bony, we have seen some young boy, hardly he was 22, 23, and suddenly he lost his hearing, and apparently no reason. And when we tested his VDRL, he was strongly positive, and it was a tertiary phase, and he just lost hearing. We couldn't recover his all other complaints we could recover, but this we couldn't reverse. It was a permanent damage. He had to be given hearing aid. So we have seen innumerable disorders where at the age of say 9, 8, the child had perforated nasal septum. It was like a punched out, as if someone has punched the nasal septum and there is a perforation. And then when we tested, the VDRL test was positive.
And now I have another question, or maybe you can enlighten us. It said that Franz Schubert, the great composer, died at the age of 33 with syphilis.
Yes.
Was there no treatment at that time?
Yes, see, the worst part in syphilis is it just goes unnoticed. It just goes unnoticed. You really don't get the symptoms at all, unless the physician carefully looks for the stigma of syphilis. It won't be evident. The person may just one fine day, what only that, even we have seen politicians or world leaders who have had exposure to the best treatment, and they also died suddenly with aneurysm getting burst open. So, and this is definitely because of syphilitic aneurysm.
Last question. What about carriers?
See, carriers, again, I say the males, females, or whatever, they have lesions which are loaded with spirochetal organisms in that. But we have seen that if it is in primary or secondary stage, it is, the person who comes in contact is vulnerable. In tertiary form, where the disease is located by the body at safer location, then the person ceases to be carrier, though the person may suffer, like aneurysm and tabes dorsalis and whatnot. But maybe if those primary lesions are not there in sexual organs or there, then the disease is not transmitted to other healthy people. So, not that every person who is affected is spreading the infection, but once caught, that person will always have that infection. And if his own healing entity is very healthy, then disease can be localized in one sector where it won't be allowed to spread. And we have seen cases where the syphilis in secondary stage is arrested in one corner in the form of, say, condylomatous growth, and for whole life the person never got any other complaint, though he has syphilis for the whole life, but he doesn't come down with any other complication. So if the disease becomes latent, we call it latent syphilis, where in that it doesn't show spread, at least through that person.
Last question. What can homeopathy do
See,
at the
homeopathy,
different
that's what
stages?
I was to suggest. That in homeopathy, what happens, we treat the person on the basis of totality. So, not only this syphilitic organism, but we go to the background, because what happens, like for example, if the person's moral is strong, moral is good, so person will not be exposed to polygamy. So definitely it is something in the background which makes the person vulnerable for such infection. So we, as a homeopath,
In the background, you mean from a past life or?
see, background in the sense, in the same life what person has acquired from childhood, or even what is inherited from the parents, the morality and all that, that in that background I'm talking. The person will not be prone for exposure to this disease. This is the background, because like we have seen, person who has morally lower down because of lower consciousness, then the person will be again vulnerable for illicit contact. From that aspect I'm talking. So in homeopathy we treat the person on the basis of totality, and somehow if the person has already contacted syphilis, then person's immune response takes up the dealing with this infection or the disease, and then starts quarantining it. So first thing we have seen is, if we are treating some patient with a tertiary syphilis, the primary chancre has appeared. It's a reversal.
Sure.
It's a reversal, because the reversal of this we consider as a good sign, and therefore it will be just localized, no question of spreading, no question of causing any ailment. And we have seen the neurological complaints or the deeper complaints start improving. And whereas the primary chancre may appear, the condylomatous growth may even grow little further, but definitely internally the person starts improving, and then the affection of the disease definitely reverses, and we can eradicate, of course. But day by day, it gets peeled off. The layers of disease stage gets peeled off, and hypothetically, at least we can say that the generation can become free from syphilitic miasm. So that at least, like we have treated, see, I'll tell you, there are some illnesses which are congenital, inherited. And you know the thalassemia major is, and again same, like where two parents with thalassemia minor trait, and when they marry, their progeny gets thalassemia major, and there the child and the family goes through nightmare, that where the blood transfusions for series have to be given to the child, and finally child succumbs. So we have treated couple like this, that where we started treating with homeopathic remedies, and after treatment of say 1 year, for this couple we allowed conception to occur. And when the couple conceived, the subsequently born son, who is now around 22, 23 now, he did not he doesn't have this disease at all. So we can definitely treat, but that person may not become free from syphilis, but definitely the reaction or response to the syphilis from that person will be adequate if he is under homeopathic treatment. And if we are treating few generations in series, definitely we can have better and better generation free from syphilis.
One more, I'm afraid. Could you just briefly tell us how allopathy handles syphilis?
Like when I have studied medicine and I have worked with under allopathic physician to learn like what these diseases are, that time it was penicillin which was being given, and penicillin used to be those days like a panacea.
Yes.
So
Oh,
for
yes.
gonococcal infections, they used to give it for 6-7 days. But when person has gonococcal infection, our medicine teacher, who was a professor of medicine, he used to presume that in the background the syphilitic infection is dormant because it won't get evident for 2-3 weeks. So he used to give penicillin for 20 days minimum, 20 days. And if it is like a secondary syphilis or a tertiary syphilis, they would inject 90 days of penicillin. But now later on, people started developing anaphylactic shock with the penicillin, and that medicine is now no more being used. But I'm talking of where I started studying medicine in 1973 to 1980. I worked in this medical ward in allopathy, and they were advocating long acting penicillin for few months at least 3 months every day they used to give. That was the treatment.
And it was the time of HIV also, wasn't it?
HIV surfaced later, like it was after 80. After 80.
So, does allopathy have any cures?
No cure. That's what. That's what. They say like penicillin used to control it, but now no cure for that. But they just say it is arrested. And what not? People have been given like arsenic compounds.
Arsenic, yes, that's what I heard. I remember
But
from
that
that
created
film.
much damage. Even mercury, they were giving heavy metals. Even mercury was commonly used, and then people realized that this treatment was more dangerous than the syphilis proper. So all stopped now.
Thank you very much, sir. Very illuminating talk. Namaste.